Joining us right now, Ravi Sharma, CEO of OOTify, all the way from Los Angeles, here in Thai Silicon Valley. Tell us what brought you out here.
Sithi, thank you for having me. So we are a Thai 50 company. We were actually backed by Thai SoCal in Los Angeles. And yeah, we're a seed stage company and really want to get plugged into the ecosystem here.
So you say you're a seed stage company, so I take you're looking for funding?
Correct. So we're on our third round of funding and we're fortunate enough to have the USC Marshall Venture Fund back us. Thai Angels is one of our biggest investors, so thank you, Thai. And we're institutional backed, angel backed, and endowment fund backed, but looking for a lead VC right now.
Walk me through, where your company is in terms of valuation and, the cap table.
Sure, yeah. So we have a really diverse sort of base of investors. We are currently valued at about $6 billion pre-money. We're raising a $2 million round, which will put us post at $8 million. I think overall the reception has been great. I feel like we're at the right time at the right place. Mental health is very, very topical. And we want to be proactive about it. We don't want the future of healthcare to be reactionary. We want to be proactive, and I think OOTify is right in that sweet spot.
Let's talk a little bit about what OOTify is and what you guys are trying to accomplish with it, and why you're able to get this valuation for it.
Absolutely. So let's start with the name OOTify. So Ut in Hindi means lift up. So a little marketing play there.
Okay.
And so OOTify is a process of lifting up our community's mental health. I first got passionate about this. You always got to figure out why. What's your why? Why are you doing this? After unfortunately almost losing a family member to suicide, and then losing a dear friend to suicide. So it's something I'm very, very passionate about. As far as justification for the valuation, we have over 200 providers on our platform, so 200 customers. We have LOIs with some of the biggest university systems in the country, 400,000 and 250,000 respectively. And we are a B2B2C business model. So we charge per student, about $5 to $10 a student, which puts those contracts at anywhere to $2 to $6 million each. So those LOIs, if we can execute on those, we're in a good place to deserve that valuation, if not more.
So, obviously folks have health insurance and they have the traditional path of going and seeking mental health services. So why is there such a big interest in working with OOTify?
Yeah, it's a consumerization of healthcare, right? So if you try to get an appointment with a mental health professional today, you're going to go to your PCP, your primary care physician, then they're going to refer you to your doctor. A lot of times they'll even push back. They'll say, hey, you don't need anything, you're fine, because they're also overutilized. They'll ask you about your life insurance, if you have life insurance, because your premiums might go up. They're trying to figure out every angle to not push you to their overutilized system. So with OOTify, you can get connected within minutes, right? So really empowering consumers to be able to get that help when they need it and supplement their current health plan. Like, we're not meant to disrupt the entire health plan system. We just want to be a supplement to it and really focus on wellness and prevention. And insurers are kind of getting interested in what we're doing as well.
Actually, that was my next question. How do you see yourself working with any of the insurance companies, and
Absolutely.
is that also a market?
That's definitely in our roadmap. So if United Health, Aetna, United, any of you guys are listening, that's definitely something we're really interested in. We were at Health 2.0 here in Santa Clara last year, and we met with Cigna. And Cigna reached out to us. They just launched a $250 million venture fund. Very interested in how AI can improve health outcomes, how you can consumerize and digitize behavioral health, because they know, their management consultants are telling them that if you lower your cost on the behavioral health side, it's going to have an impact on your entire insurance book and drive down costs significantly. And that's, BCG, McKinsey telling these big behavioral health payers, like, hey, you need to look at this very, very seriously.
Indeed, it is definitely one of those spaces that has been growing tremendously, and
Yes.
you've managed to do the hottest thing, which is combine AI with mental health services.
Yeah.
So kudos to you.
Thank you.
Congratulations to you, and good luck. That was Ravi Sharma, CEO of OOTify.